there and we go and we meet in the car park downstairs, or to the left, to the stairs by the lift, not using the lift. And is there anyone here that believes they will need assistance in evacuating the chamber? No? Okay, thank you very much. Can I now ask, have there been any apologies for absence?
Thank you, Chair. I have apologies for absence from Councillor Kieran Golding, who is substituted by Councillor Dolly Wooster. I have apologies from Councillor Chris Palmer, Councillor Neil and Councillor Perkin, but as she said, she is online.
Are we recording? Because it's not on. Thank you. Okay, thank you for that, Billy. Can I ask, are members happy to approve the minutes of the meeting held on the 22nd of October 2024, minutes number 356 to 364 as a correct record? Agreed. Thank you. Declarations of interest. Are there any declarations of interest for tonight's meeting? Councillor Gould.
I'm a GP in Swale, so.
Thank you. Any others of pecuniary or non-pecuniary interest? Thank you very much. So, councillors, committee, we now move on to the presentation by Nikki. Can I please ask you, if you have any questions, to one, indicate very clearly, because I'm trying on breaking in my new glasses, and two, can we do it at the end of the presentation so Nikki can give her presentation and then answer any questions we may have. Over to you, Nikki.
Thank you very much, Chair. And firstly, apologies, because I thought that the report would be with you all so that you'd have had time to read it and digest it before I came tonight. So my plan was to talk through the report briefly and then go straight to questions. But given that you're glancing at it now, I'll try and walk you through the report. So I work for the Health and Care Partnership. I do not work for the ICB. I'm not directly employed by any particular organisation. I work for Place. So I work for the whole of our Health and Care Partnership. So that includes Swale Borough. They're a key member of our Health and Care Partnership, and everyone else who serves and works within the Medway and Swale footprint. Which puts me in quite a unique position, because it means I don't have to get involved in any organisation's politics, internal politics, and it means that I can proactively do what's right for our population as opposed to the needs of particular organisations. We've got quite a large team, and the essence of this report is, I suppose, to try and give the members here a little bit of an oversight of where we're trying to go with the Health and Care Partnership as it develops. We're in our 4th year, and I think we've made some quite remarkable progress, and I have been to this committee before to sort of talk about that progress. But today I wanted to focus on integrated neighbourhood teams and where we hope to come with them, and what we're trying to do with our delivery plan in relation to sort of serving the needs of our population. Everything we do in the Health and Care Partnership is based on population health management. So everything we do is evidence-based, and it's all tested with our population. We spend an awful lot of time with doing engagement and talking to our communities to make sure what we're trying to do fits the needs of the communities, as opposed to put the communities in boxes because it's something that health has designed. We've tried very much through the Health and Care Partnership to turn that on its head so that we're approaching health and well-being in a really different way. And one example that's cited in the report is, sorry.
So can I quickly just clarify, when you say population, are you talking about national population or
Medway and Swale? Everything I do is Medway and Swale.
Okay, thank you.
What we're doing, so whilst the ICB are very much Kent and Medway focused, and I have many challenges because when you put particularly data at Kent and Medway level, it dilutes that data and it takes away the need at locality. So it's constant, it's Medway and Swale.
Fine, thank you.
So one of the programmes we've done was a Health Catalyst programme. We work really closely with the voluntary sector. They're a key equal partner within our Health and Care Partnership. And we have, through our 2 voluntary organisations and the Alliance, we have reached into nearly 1,500 voluntary organisations through that process. So they're a key partner in what we're trying to do. And when we spoke to, the Health Catalyst programme is about getting to know communities and about giving communities the solutions themselves to build resilience and to try and give themselves a better output and a better chance at growing their own communities. And we spent nearly 6 months getting to know these communities, and that was going to have coffee with the communities. It was, going and just meeting, greeting. We didn't ask any questions. We didn't give them any surveys. After 6 months, we started listening events to ask the communities what would improve their health and well-being. And we did this over quite a long time, so we had real trusted relationships. And some of these communities were our really, really sort of troubled communities and those that are most vulnerable. We asked over 2,000 individuals what would improve their health and well-being, and not one person said a health intervention. Every single person said something that fitted in the wider determinants of health. So something related to housing, or something related to cost of living or food, or, it was something outside of health. So from that, we've made social regeneration our backbone of the Health and Care Partnership. So what we're trying to do, whilst we're absolutely clear that we need to improve clinical outcomes, what our public and the population have told us is we're not going to do that unless we help people with the wider determinants of health. So we're very much focused on doing things differently, and we're working very closely with housing colleagues to improve social housing. We're working with green doctors. We're working with voluntary, with food banks. We're working in a really different way, in much more of a public health type of way, so that we can try to help communities improve their own outcomes. And if I can just give an example of how that relates to health, because I know that seems, health is clinical intervention, and I'm a clinician by background, 30 years in the NHS. Absolutely, we need to do the clinical bit. But if I can just direct you to page 6 of the report. I want you to meet Jayden. So when we first met Jayden, we met Jayden at a food bank. Jayden is a 6-year-old Afro-Caribbean lad, suffers with asthma, was having probably a monthly attendance to Medway Hospital via ambulance because his asthma was really poorly controlled. Jayden lives in poor accommodation. Jayden had damp and mould on the walls. Jayden's mum is a single mum, really struggling to put food on the table and struggling to give Jayden the life that she wants to give Jayden. Jayden's mum was not confident in sending Jayden to school because she wasn't confident that the school could adequately look after Jayden and look after Jayden's asthma. Jayden's mum wasn't allowing Jayden to go to any local sports clubs or sports facilities because she was worried about the impact that would have on asthma and obviously them not being able to look after him properly. So we did the clinical bit. We got the consultant actually came out of Medway Hospital, came over. Jayden lives on the island. Came over and done a clinical review in a local facility for Jayden so that we could actually put the clinical management plan in place. Because although Jayden was having regular attendances, he wasn't actually being admitted to hospital. So he was being discharged back and there was very little follow-up. We also went out and done some education with the practice nurse. The practice nurse didn't have a paediatric qualification in asthma, so we upskilled the practice nurse so the practice nurse was obviously able to look after Jayden but also able to effectively manage other children as well. We did the clinical bit, it didn't make any difference. Jayden was still being blue lighted to Medway Hospital. So we spread our wings a little further through social regeneration and through the programme. We worked with the school. We made the school an asthma-friendly school. So we taught all the staff how to manage asthma. We had education sessions with the children. We had education sessions with the parents. We worked with the green doctors. We got the green doctors into Jayden's accommodation. They worked with the local housing, it was a private landlord, to get Jaden's house so that Jaden's house was adequate. We worked with a local football club because Jaden was desperate to play football, and we made Jaden's football club asthma friendly. We worked with the voluntary sector to get community support for mum, so mum didn't feel so isolated. Jaden hasn't had a hospital attendance in a year. Now, that's not just Jaden, that's lots and lots of kids that have benefited. Since that programme's been running, which is just over a year, we've got 38 schools that are now asthma friendly. We've got 397 clinical professionals that have now had education and training, 835 non-healthcare professionals that have had education and training, and 45 community events where we've had over 200 young people attend those events, as well as their parents, and given them education and training. And that's what we're trying to do. That's the essence of everything that's in the report that we're trying to do, and how we're trying to change people's health outcomes, but by doing it really differently. I'm not going to touch too much on anything else, I don't think, in the report. And I appreciate, and again, apologies that you've not had time to read it and digest it, but happy to take any questions, obviously either from the report or that you just have generally.
Okay, thank you, Nikki. Councillor Harrison.
I suppose we have known for some years that it is the wider determinants that mostly affect people's health and well-being. And indeed, every time I go to one of these meetings, I say, yeah, but don't forget, you're only the 20%, I'm the 80%. Is it actually filtering? We're very lucky, Nikki, because you really got this holistic picture, but is it actually filtering through to the powers that be, if I can put it like that, the people that, no, you don't need that, don't they? No, you don't need that. Because it is the wider determinants that are going to make the difference in terms of the budget, and the wider determinants that would determine how we go forward. Alistair can dish out antibiotics because you've got a chest infection, but if you're going home to a cold, damp, mouldy home, Alistair knows that you're going to be back to see him at least within a month, and he's going to do another script. Now, that money could be better served out there dealing with damp and mould problems, so that we don't actually take up NHS resources, because we've sorted out the problem, and the NHS would be there for the major clinical interventions. Touch wood, I've not had none. I break my leg, I expect to go in hospital. I've got a brain tumour, I expect to go in hospital. Other than that, back here. So I suppose, is this message filtering through to the people that make the really senior decisions, if that's the right way to put it? Thanks.
So there's two parts to my answer. The first part is obviously the ICB make the commissioning decisions here. Up until the end of this financial year, we had control of health inequality money at locality level, which meant for our patch just over £1 million that we were able to direct into locality to improve health inequality. The ICB have made a decision that money is now centralised, so as of April we don't get that money anymore. I think from an ICB perspective, they're looking at it from system-wide inequalities as opposed to locality inequalities, which, as going back to my point about diluting need, when you look at need at system level, it doesn't recognise the disparity of, particularly, so if you take Sheppey in particular, and certain areas of Sittingbourne, because that's the only areas I deal with. I don't, my patch for Health and Care Partnership doesn't go, it does that corridor. so it doesn't do Faversham and Tenham, it just does that corridor. But if you take Sheppey, the data gets lost in system figures, so you don't then see the need, which is why the Health and Care Partnership continuously fights. Now, what we're doing in relation to that, so that money is gone, we're not getting that money next year, which does put a few of our programmes that are targeting health inequalities at risk. What we're doing through the Health and Care Partnership is looking for alternative funding sources outside of the NHS. We've brought in just over £1 million to voluntary sector organisations in this financial year, through lottery grants, through working with our business partners who have social pots of money that they have to spend on communities. So we're targeting different pots of money to try and bring that money back in to continue the work we're doing. Obviously, the ICB is in a quite tight financial situation. I don't think that's any secret. But it is disappointing, I think, that the need has been centralised.
Thank you, Nikki. I'm going to take Councillor Perkin, if you don't mind, Councillor Bowen. Hannah.
Thank you. Can you hear me?
Yeah, we can hear you loud and clear.
Great. Thank you. So thanks. Unfortunately, I haven't been able to see the document because I haven't been able to get there. But I just wondered if you could cover 2 questions. The first one is there any specific work being done around loneliness as a health determinant? Because clearly that's becoming more and more of an issue within the NHS and leading to very poor mental health outcomes, especially. And secondly, is there any similar kind of programme running that could impact Faversham and the surrounding villages? Because obviously that's where I'm a councillor, so it'd be interesting to understand that. Thank you.
Nikki?
Thanks. So I'll come back to the Health Catalyst programme, which I spoke of, where we did the engagement. A lot of that work is looking at isolation, loneliness, because we know the impact that has on poor health outcomes. What we do with that programme is, once we've done the listening events and once we've done the year of getting to know those communities, we had a chest pot of money that we were able to give those communities, and they put in very high level, sort of, 2-3 liner bids. So we weren't asking communities and voluntary organisations to do a normal NHS type procurement exercise, but a very high level bid to put in, so that we could give pots of money to those communities so that they could do just that. And there's an awful lot of communities that have put solutions in that meet their needs, that aren't necessarily solutions that we would have come up with if we'd been sat in a room. So in answer to your question, yes, there are a lot of initiatives. I think at the last count we had about 46 different programmes running through the Health Catalyst programme that we've had running up this year. In relation to Faversham, I don't have the answer to that, but I can send a note through following this meeting.
Is that okay, Hannah? I don't know if this is going to be any help, and I'll offer it to you, Councillor Perkin, if a copy of the document that we've been given tonight is put in your pigeonhole.
That'd be really great. Thank you.
Okay, thank you. Councillor Bowen.
Thank you, Chair. Slightly following on from Councillor Harrison's comments, so I totally agree. I work with, I'm not a physiotherapist, but I work with physios. I work for their professional body now, and it's one of those that actually recovery and care at home and in the community is far, far better. I think hopefully Councillor Gould will agree with this, than actually having somebody propping a bed up in a hospital. So provided that home environment is sound. And if it's not, then that, as has been said, you're going to have repeat prescriptions going out and repeat visitors to whether it's GPs or hospitals. And in that sense, that it's almost like the prevention is better than a cure. And I totally agree with that. So I welcome the report. I welcome with what you do. I think it's great. I also agree with the frustrations about ICB and the money. That's a case of I think, everywhere that sadly money is tight wherever you go. In terms of just a clarification in terms of what you were saying, I've got a particular interest because my wife is a type 1 diabetic. In here it says about on diabetes will be support patients through holistic care plans. But obviously there is quite a difference in terms of the two types of diabetes that people have, and whether you're insulin dependent or whether it's a tablet or dietary control would be has completely different impacts on people's lives. So I wonder what the holistic care plan would be there, because again, if you're type 1, actually it is the medication, because without that you die. Either a very long or very potentially quick and horrible way to go. So just interested in that. And in terms of the other two, again, I possibly should know this, but can you explain a little bit more in terms of what asthma-friendly actually looks like? I mean, so you say about asthma-friendly football, asthma-friendly schools. I'm intrigued by what that is, and also at the same time, green doctors. What are they? Thank you.
Thank you. So in relation to diabetes, we have a fragmented diabetic service, regardless of whether you're type 1 or type 2. We are a national outlier for amputation, and that's generally in our population type 2 as opposed to type 1. We have pockets of excellent practice across our area, but it's not consistent and it's not universal. And I'm talking obviously across the whole of Medway and Swale, not just the Swale footprint. What we're trying to do is we also don't manage diabetes very well in our hospital. So we don't manage diabetes in the way that we should be managing diabetes. We keep patients in too long, we don't stabilise them properly, and we don't get them out as quickly as we should be getting them out. So we need a whole overview of what we're doing with diabetes. We have had some specialists come in to do a system diagnostic on where our gaps are in service provision and in care pathways. What the report talks about is integrated neighbourhood teams, which is, you may have heard that banded around. It's the new sort of buzz thing at the moment, and we're all working to integrated neighbourhood teams and with an ambition to have complete all singing, all dancing integrated neighbourhood teams within 5 years, and that means everyone within the neighbourhood, so within that particular neighbourhood, whatever that patch looks like. And we've got one in Sheppey, one in Sittingbourne that we're looking at starting. But everything will be meeting the needs of the people and population within that locality. So if you had, and obviously I know this is extreme, if you had no children living in Sheppey, then you wouldn't need health visiting services if all the children were living in Sittingbourne. At the moment, we've got our health services aren't split up to meet the needs of populations. So it's not anything that you can see physically, it's how everybody works, and that's local authorities as well as healthcare services. So when we look at what that diabetic pathway looks like, and it's not designed yet, it needs to be designed. It needs to have all the clinicians come together. There's, I think the first workshop is planned on Friday this week, but it needs everybody to come together to look at to do a gap analysis and take the results from the specialists that have been in. Sorry. Before we start to redesign what that looks like. We've already done a big piece of engagement with our population about what people would like that service to look like. So we did do a big piece on that. So it will also be fed by that, and we'll have patients and people that actually use services on the groups, because generally services are designed not necessarily by the people that use them. In relation to your other two questions, so green doctors, it would be really good to have the green doctors come and give a presentation here. They're fantastic. They're absolutely fantastic. What they do, though, they go into people's houses and they will do a cost effective on their heating. They'll teach people how to put things in place within their homes, in their environments, to save them money. And they save them quite a lot of money and allow them to sort of turn their heating on, and they've got all wonderful tips and things. So they're really really brilliant, and it's worth a demonstration because it's really valuable. Asthma Friendly is about teaching the schools the triggers for asthma. We also, so the schools will get, that are asthma friendly now, get alerts when there's high air pollution within the area. It also teaches them how to use the inhalers correctly. It teaches them what signs to look out for. It teaches the children what signs to look out for with their friends. It teaches anaphylaxis training. So it's a whole package. It's not delivered only over one session. It's over several weeks that they go in and reiterate the training. It teaches kids how their lungs work and their parents so that they can understand how asthma actually works within the body.
Thank you, Nikki. I have Councillor Worcester next, please.
Thank you, Chair. Sorry for being late this evening. I was trying to sort out a Southern Water issue in Granville Road this evening, so I do apologise. And I didn't know the local main route to here was closed, so I do apologise. I've got a question. I had it when the reports come out, but I want to try and make it relevant to the stuff that you've been talking about already, if that's okay. So bear with me. When I first saw that you were on the meeting, I had a question about if we're doing our best to share accommodation. So, for example, quite a lot of the space at Sheppey Community Hospital is underused, and actually it's a lovely community hub. Lots of people would like to use the hospital more for more services. We're very lucky we've been given a diagnostic centre and the X-ray department has just reopened, but there is space and room for more. And obviously we're looking at efficiency, so that facility is already there. So I'd love to see more community work coming out of the hospital. But it does lead me on to two other conversations I've had today, which is they've just started a fantastic Sheppey Matters hot food provision in the local community centre. But when I was speaking to the volunteers today, they were raring for more things to happen at that point. So, for example, they would love to have, for example, maybe health visitor checks. They'd love to have maybe somebody popping along to show people how to use their asthma pumps properly, how to do diabetes checks properly, all looking at really simple things that at the moment take up potentially GP's time, could actually be provided in short excerpts in the community setting that organisations are already set up. So that's ongoing now for 3 months, thanks to the local parish council and Sheppey Matters working together. And for example, using our schools very much more in the same vein of sharing accommodation, because quite a lot of our school buildings, for example, I'll take Westminster Primary, they have a Ivy Centre, which is a speech and language unit, but they have a lot of outbuildings, they have a lot of parents, almost 900 children attend that school, and they are meeting places for parents, carers to come together that would be crying out for more support from health practitioners. And these people may avoid their GP for lots of reasons, but do not avoid their school. So is there anything we can do about making that more efficient for communication and sharing of community facilities that are already there for you without finding money for rent, for example?
Thank you, and yes. So Sheppey Matters, we already work really closely with Sheppey Matters. We've done asthma-friendly training over there already, and we've also taken other health checks and things to Sheppey Matters. So they're very much on our radar and very much on the list. We're trying to get into as many community places as possible. My team are probably spend more time in Sheppey than they do anywhere else, actually, because of the need. And there is a huge need. We know that the clinical outcomes in Sheppey are some of the worst in the country. And we know that. And that's, again, not necessarily because the health provision isn't there. A lot of it is because people have other priorities than their health. So most of our cancer diagnoses that happen in Sheppey are in stage 3 or 4 as opposed to stage 1 or 2. And we see that with any area of deprivation. So if you have an affluent area, people tend to seek help and get treatment earlier for a variety of reasons. So the more places we can get into, the better. So if you've got any contacts that we can get into other areas, that would be great, because I've got teams and clinicians wanting to come out. We're looking at, currently the ICB have got a community service procurement underway. So it's very, very difficult to move forward with any transformation at this moment in time, because our local providers, so HCRG, who serve Swale, are obviously in a competitive tender process at the moment, so it's very difficult to do any sort of transformation. But they're a very, very willing organisation, and they're very keen to get out into the community settings. So I don't think that will be a problem, and we'd like to get into that space more. In relation to Sheppey Hospital, you're right, the CDC, Community Diagnostic Centre, is almost done. The MRI will come online. That's the last thing to come online, but CT scans are up and running now, which is great, and great for Swale. We do want to use that space more. We're having lots of talks about how we can particularly support frailty from the Sheppey Hospital and Sheppey facility, because it would be huge benefit to Swale if frailty could take more of a presence within the Sheppey facility. So yes, we are in conversations to use that more.
Can I quickly come back, Chair? Is that okay? Super fast. So the two areas that are really glaring obvious over on Sheppey that need much more help are obviously COPD. They went down from one professional nurse to two professional nurses to one. That is a massive issue over there. And obviously you are absolutely more than welcome to have any of my contacts, whatever you need. And if you need any support getting into schools or community groups that I look at, then absolutely, whatever partnership you need, definitely open for that. Thank you.
Thank you. Councillor Gould.
Thank you. I was struck by your case study with Jayden. I was just wondering whether there'd been sort of work done on the cost effectiveness of your intervention, because by the time you've blue lighted a child to A&E several times, and by the time they've been given lots of inhalers that are 30, 40 quid a pop and not working, then I would have thought the interventions that you're doing must be greatly more cost effective. And if that's the case, why are the ICB not looking at it in the longer term, that actually to do that sort of work will save them money? And money is tight, and just picking up on the comment about the diabetes, I mean, part of the problem is just the lack of availability of specialist diabetic nurses as well. And the general practice were not really geared up historically to deal with type 1 diabetes, and yet the provision from the hospital seems to be getting less and less, and so sometimes health interventions are needed, but often they seem to be getting thinner and thinner. But there is a need for a real look, I think, at the cost effectiveness of your type of programme, and I just wonder whether that's something that you had sort of figures on.
Yes, I do. And we're currently pulling a business case together to put into the ICB, because this service can't stop. And this service cost £75,000. So all we did was employ a paediatric asthma clinical specialist nurse. But for £75,000, that nurse is making an absolutely massive difference to individuals and communities, and the financial budget. So yes, we're putting that together at the moment. We are looking for alternative funding sources, because I'm not overly confident that any new initiatives are going to be accepted at this moment in time. So we are looking for alternative funding for that particular role.
Thank you. Councillor Kavanagh, please.
Jayden's case study made me think of practically 30 years ago, I worked in the OT service, and my first client, who was HIV positive, had an AIDS diagnosis. He had pneumocystic pneumonia, and I managed to get him, through a housing report, moved from a damp, privately rented flat to a council flat, and he was so delighted. It saddens me, though, that 30 years on, nothing seems to have changed. I know it's beyond your control. It's just sad.
Okay, thank you. And Councillor Martin, please.
First off, I'll have to do a DNPI, disclosable non-pecuniary. You mentioned Green Doctors. I do pretty much the same role now as the Green Doctors do for 16 properties in Sittingbourne and Sheppey. 2 of them are on the island. I'll start by addressing Councillor Bowen's point there. In 20 visits, I saved £6,000 for people on their bills. That's the level that the Green Doctors do. It's not just that, though. It's the other side of it. It's the priority service registrations, making sure they're up to date, making sure that people realise they should be on them. And anyone that's diabetic, I would beg, contact the UK Power Network's annual utility supplier and make sure if you have medications that have to be kept chilled, they are aware, because they now come out with power packs for fridges to make sure that your medication stays safe. Because the last thing they want, and the last thing anyone wants, is that medication going off and not being usable when you need it. So we need to make sure people are on priority service register as part of that holistic approach. I think when we look at that in terms of also the holistic approach, are EPCs being considered when we're looking at some of those properties that have got issues? If it's below a G, it shouldn't be being, below an E, it shouldn't be being rented out at all. So it does need to make sure that that's being checked. There needs to be an element of common sense as well. Dare I say it, between Christmas Eve and Monday of last week, there was a customer who was blue lighted 3 times. 3 times the hospital contacted for discharge, and the request was, is the heating and electricity working in the property? Now, that's something that the paramedics would have noticed from the fact the lights were on when they arrived and it was 24 degrees in the property and the radiators were hot. There needs to be an element of common sense when handing that over, because actually that ended up with the patient staying in over the weekend because I got the third call on a Friday night at 5 o'clock. Well, I need a second bod with me to go into that property without the customer there. So that's now Monday morning. They're not discharged till Monday afternoon. There has to be that element of having all the information at that point to have that holistic approach. Are there any data sharing agreements in place? Because, again, data is absolute king. If there's data sharing in place with the utility providers or with the housing providers, it enables a proper package to be put around that supports that individual, that family, to achieve what needs to be achieved and to get more positive outcomes. If we're not talking to each other or we're all hiding behind GDPR, then worst case scenarios happen, and we're seeing that now. I know the last few days, because I couldn't physically get to properties quick enough, people aren't heating them. So there are people that are dying in them because they're cold. So we do need to make sure that we're all talking as much and openly as we can. And even if it's just a nod and a wink, you might want to visit that property number, because we can't disclose any more than that, would be really, really helpful at times.
Thank you, Councillor Martin. I'm going to take one more, and it's Councillor Harrison, please.
Okay, 2 points. Nikki is Medway and Swale Health and Care Partnership. There are 4 health and care partnerships. I'm pretty sure, but I'd like you to explain how it works. The 4 all talk to each other. The 4, I'm pretty sure, all share best practice. And, oh, yeah, we're doing that. Oh, you're doing that. Oh, can you talk to me about that? Because that'd be interesting in our patch. So there is some really good work going on across the four. In particular, I know two, which is the one that covers Faversham, because I know some people down there. There is some really good practice going on, and it's really just to say, can you confirm that you all talk to each other and share this stuff and pinch ideas, if that's the right way to put it. And the final point was actually the Green Doctor. I did say we should use this term because I know this, but we have got a Green Doctor, Lloyd. It's called the Fuel and Water Poverty Scheme. We put out a tender, and Seashells actually won that tender, and they've been providing this service for some years in Swale. I believe they got grant funding to continue it, and pulling it back from the brain. It was started by Tim Valentine, and when he came up with the idea, I said, "Oh, you mean the Green Doctor?" Because we had it many moons ago when we were retrofitting Rushington, and they were. I know they had I think they had a target at the time of 400 properties in a year, and they did over 800, and it was a fantastic service, but unfortunately that went. But certainly Tim Valentine, when he was a cabinet member, started that service up, and it is still running in Swale, and you just literally book an appointment and they come to your home, convenient point, and literally go round the place. It's a fantastic service, and it does make a hell of a difference. Yeah, and also sometimes they have these freebies that they can give you, like the electric light bulb that lasts for 25 years or whatever. So I'll talk to you afterwards if you want. But yeah, if I could have that answer, Nikki.
Yeah, we have a catch-up meeting every 2 weeks, so that but obviously bearing in mind that our demographics are very, very different. There are, we share best practice and we take ideas, but it's not very often actually that we can implement in the same way as each other, because of the population needs and because those demographics are quite unique.
Good job.
Okay, so a couple of comments I wanted to make on it, and that is it's encouraging to see the holistic approach moving forward. I think something I've banged on about for years is look at a problem isn't just a problem. You need to look outside the box, and what you've told us tonight is definitely looking as though we're going in the right direction. Obviously, the importance of partnership working as well. I think we all know that, and communication. Obviously, something going out today, which was that Swale are looking at the impact of damp and mould in people's homes, and looking at ways that we can try and reduce that. So I've got the thing in front of me, so I'm trying not to be clever. And it's all about the Healthy Home Scheme. So I think moving forward, we are, as you said, Councillor Bowen, it is all about prevention being better than cure, and this is what we've got to look at. If you can prevent that ambulance coming or that prescription going in, then it's all for the good. So thank you very much for coming, Nikki. Yep, not a problem. Please do.
Yeah, I just wanted to say, obviously I had thought that you guys would have read the report, but if you are going to read the report post this, and you do have any questions, I'm very, very happy to take questions after the event, and I'll come back to you in writing.
Lovely. Thank you, Nikki. And I think we all really appreciate you coming out and facing us tonight. I think we've been fairly friendly. So thank you very much. And if I can do a quick adjournment, just so Charlotte can escort Nikki down, otherwise she's going to be wandering the corridors of Swale. shall come back to the meeting. Item 6, which is the Housing Assistance Policy Review. Charlotte,
yes.
would you like to introduce the report, please?
Thank you, Chair. So the housing assistance policy set out a review that has taken place regarding our housing assistance policy that actually hasn't been before this committee for a long time and was last updated back in 2021, and mainly that was through delegations. As part of the review, a member working group was created to sort of look at some of the performance data that was currently taking place, looking at how the funding was being used and sort of recommendations for proposed changes going forward. I think it's probably important to say that a lot of the stuff contained within this policy is sort of governed by statutory guidelines and best practice and various other things. So there's quite a narrow scope of work to be able to have the freedom to sort of make changes. However, there was some really good conversations regarding improvements to the policy, and if I sort of point you to paragraph 2.14, these are the recommendations that come forward. The main recommendations really are around increasing the financial limits of some of the applications because of cost of living changes and inflationary elements. So there was sort of three key areas. One was around increasing the loan limit for the decent home loans, which is currently £5,000. It's very difficult to do repairs within that amount. And the reason that people need to have a loan is because they don't have the finances to be able to take that place. So increasing that to £10,000, and they are loans, so they do get repaid and get recycled in terms of that fund. Secondly was raising the income threshold for means tested assessments from 8,000 up to 10,000, and again just reflecting the impact on certain individuals around the ability to be able to make those payments with modest earnings. And the final one has come up really regarding the pace at which adaptations are taking to take place. So the grant application process takes place fairly swiftly, but we are reliant on occupational therapists to do their assessments as well. That can also take time because there's a bit of a shortage of occupational therapists, and there are delays in terms of getting those things through. However, the large delays are through contractors that are significantly limited over the last couple of years because of impacts in that industry, and then actually getting the works done. What we are finding though, that some people that actually have quite significant life-limiting illnesses and significant deterioration are getting adaptations probably too late to really make that impact on them. So at the moment it's very much a queuing system, so again within the policy I have to say it would probably be quite a limited opportunity to do this, but a delegation to the private sector housing manager to fast track patients where a specific set of circumstances arrange where you might need to sort of jump them to the top of the queue to make sure that those works get done quickly to impact on sort of the remainder of their life. The draft policy in front of you is here as a draft to go out to public consultation, and happy to take any questions.
Thank you, Charlotte. First of all, I'd like to thank the working group for the work they did. And as a member of that working group, I would like to say that the report we've got, the presentation we were given on the night was excellent. So I have got Lloyd, Tom and Anne. So Councillor Bowen, please.
Thank you, Chair. I agree. I like the report. It's a good one. In general, I think the policy is fine. So congratulations on that. Few observations, and this is being nitpicky, I know. On page 11 of the actual policy, and this is my probably over-analysing how it's going on the mandatory disabled facilities grant, DFG, the paragraph second paragraph, often housing associations, if I read that and something happens, then there'll be residents who come back and will say, well, you say often housing associations, and actually in cases where some may not, and are we actually opening ourselves up for some form of, I'd say criticism, that may not be the right word, or comeback. I just wonder whether, again, to avoid that potential conversation, whether the wording may be actually be better that housing associations may be able to assist their tenants, rather than putting the caveat of, well, that often they do, when actually they may not. I don't know. So it's playing on words, but people do get totally bound up in what they read, and your policy says that, so and it might be my printing on this, but the layout goes really wonky later on in terms of the titles. The no-use empty initiative loans, again, just for clarification, it says eligible owners can apply for loans through Kent County Council under the no-use empty scheme to bring their dwellings back up.
Oh, yeah.
How do we know then that those owners aren't then going to use council public money to upgrade their homes to then use for private rent or sell on because actually they haven't maintained it themselves? Or have I missed the point on that one? And my final one is, because I'm doing a course on it at the moment, today actually, in terms of, you said about the identifying cases and fast tracking them. So what's the actual process are we making use of AI, for example, to identify in the responses to applications or questionnaires which may come in? Because if you get a bundle of 200 questionnaires that come in, that's going to automatically take time to read. But if it's done online, you could, in theory, use AI to say, like warning beacons come out, actually this one has met this criteria and you need to look at this first, because it could be one that needs to go to the top of the queue, rather than work through all 200 and then find that one needs to go to the top of the queue. Does that make sense? Thank you.
Yeah, through you, Chair, thank you. So in terms of the no use empty, I would probably need to go away and have a look at this, but generally, depending on whether it's a loan or a grant, certainly there is a time period around, like if we have to do works on a property, we would attach some, a charge to the property and things like that over a certain period, and then that would go after a certain time. So I would imagine there are restrictions. In terms of it being empty, sometimes it actually being rented out might be a good thing if they are doing that. But what I will do is I'll get a response around the conditions of grants that are put in there to share with you, because I think that would probably alleviate any of those concerns. Yeah. And in terms of the fast track, so in order to really be eligible for a disabled facilities grant, a lot of the majority of the time, the referral will come from a practitioner. So whether it's from an OT or from a GP referral or something like that, we need an OT report to identify and specify the adaptations that are required. So it's quite evident when works are more urgent than not, and a professional can flag those. And then I think it's more about making sure, we get the contractors quicker and we get the application processed. I think AI is definitely something that we do need to explore. Currently, and it does set out in the report, and San, who is as the interim private sector housing manager at the moment, has been doing quite a big review of the team, and some of the systems are outdated, and he's doing a piece of work to modernise those, and all of that type of stuff will help speed up the application process and analyse it, and making sure we can increase and monitor performance more effectively as well.
And
the wording, yeah, more than happy to sort of make that amendment.
Councillor Nundy.
I'm not sure if I need to make a declaration of interest on this, because my partner has had some work done on the property that we live in based on her disability, and I'm not sure where that's come from off the top of my head. Oh, okay. In which case, great report. Thank you.
Thank you, Councillor Nundy. Councillor Kavanagh, please.
Thank you. Yeah, I was part of this working group, and it was really useful to be on the other side as someone who was at one time assessing people for disabled facilities grants. Page 23, 7.4, it says any appeal against a decision will be to the Cabinet Committee of the Council. We don't operate under a cabinet system, so please change that. The other thing about the speed of the work being done, when I worked for Waltham Forest, one of the local contractors admitted that we were at the bottom of the list because we were slow payers. So if a private person wanted a bit of work done, he would get theirs done first in order to live. So I don't know whether that's the position here, but the quicker you can pay someone, maybe the better they will see your work. Thank you.
I mean, certainly that's something I take back to the team, and I know that they do have contractor meetings, at least on an annual basis, where they obviously want to address any concerns that the contractors have and making sure like specifications and various other things are dealt with promptly. So if payments does come up with an issue, then we can. Our service levels of payment invoice processing are quite good here, so I'm hoping that they wouldn't, but obviously they probably might be a bit slower than you've just left my house and I've just done a bank transfer to you. So, but I'm not sure, you know, because we do require an invoice and it does have to go through an authorisation process, we may be able to speed those things up, and we can certainly look at that if that is a barrier to getting the works done.
Okay, thank you. Councillor Martin, please.
Thank you. As ever, good report. Where should we start? Let's start with the amounts there. We're looking at going out to consult on a 10,000 limit. Should we not make that threshold level with the pension level? So the 11,000, where are we? £11,343.80. Because I think if you're a single pensioner, you can't afford the works. As a general rule. Is where I'd be looking in that regard. In terms of the form as well that's utilised, it is very mobility heavy, and I can't see how it would comply with the new requirements for fair access. If you're particularly if it's the social landlords, they've got to compile all sorts of information now on the tenant's needs and adapt the way they communicate and what they offer that individual. And I'll take the example of a fire that occurred on Boxing Day, where the individual wouldn't normally need any aids or adaptations, but they were blind. You get a blind person out of a building that's on fire. Ain't easy. So there may be other adaptations that are required that are not necessarily mobility aids, but are for other aspects to maintain the safety of them in their home. I think that's pretty much it, because everything else... Oh, I remember I was going to ask, when you say that they're outdated, are they still the archaic paper-based folders and files that they were in 2021?
They are.
Still not digitised.
No.
Okay.
No, progress has been made in terms of digitalisation and looking at the software. I think parts of it have been, but not fully. And I think that's the bit that we need to have a big overhaul and an investment and a manager within the team to lead that work to make sure it happens consistently and effectively, which is happening.
Thank you for that. Councillor Worcester, please.
Thank you, Chair. I just had one question, and it was more for future work, because I thought this report was very good for the situation we find ourselves in at the moment. But today we've just had the Labour government pushing the Renters Reform Bill to the House of Lords, which I think is very good news and very positive if that can come off. But I would like to say that I'm looking for a bit of reassurance that when that does happen, would we be able to go back and revisit? Because at the moment, part of the, like Councillor Bowen's question, was part of the element was that landlords can have access to this if they've got a tenant that qualifies potentially. And I think we could, on our social tariff, what we should be doing as a council is linking up this sort of grant application scheme or assistance application scheme eventually with helping that tenant stay in that building to actually enjoy the results of the effort they've put in to apply for any sort of changes that is needed to the building to help them stay safe. And I'm seeking a bit of reassurance that even if we can't consider it now, that we may come back and consider that at future points. Thank you.
Yep, certainly happy to review that. And think, just to add, we are re-establishing our landlords forum work as well, and did an event just before Christmas as a bit of an engagement process. And the Renters' Rights Bill / Act, at the right time we will be doing some work and briefing with our local landlords and getting their views on how we can work with them to support them and support tenants in those properties. Will obviously be key part of that work, and we can again test this policy with them as well.
So the specific part I was looking at was that the potentially the tenancies would have no end, which means that technically we could look at an agreement where the tenant we could link those two systems. Yep. to make sure that tenant benefits on a long-term basis, potentially.
Yeah, certainly.
Thank you. Councillor Harrison, please.
Thanks, Chair, and thank you to the working group. It took a while, but you got there in the end. And I would be supportive of the 3 recommendations that you came up with. I think they're quite commonsensical. I think the information in the report itself there's some valuable information here, and going back moons where we had waiting lists as long as your arm of people who needed a DFG, and we just could not cope with the demand. The amount of people that we're getting through and helping out is really good, and I think some of this clutter cases, I don't know how many of those sitting here appreciate that hoarding is a medical condition and you can get help for it. Quite often we find out there is a problem by accident because neighbours are moaning about vermin, and so councillors get on to poor neighbours, when in actual fact the poor neighbours actually got a medical condition that they need help with, and that is not widely known, to be fair. So looking at that 84 cases that we've helped, I think that's really good. Now the one, I almost hesitate to say this because part of the problem, and by the way, I think we've got a 30-day turnaround on invoices, so you've got to be paid within 30 days. I know a council down the road, lots of contractors refused to put in tenders because they could wait 6 months to be paid. So I appreciate that. What I was going to say was that I do know a very good contractor who actually was, I don't know if he still is, was on the Housing Association list of, I'm going to say odds and sods works, which is what I call this. It just meant that my work got further down the list. So I hesitate, but they are... would you be interested if any of us know a really decent to pass over the contact details? Because quite often with council, and this goes into our social value stuff, quite often with councils, the sort of bloke down the road who's got a little family business, they're, as reliable. To be fair, my builder, I gave the keys and moved out for a week, completely trusted. And you don't get them people that often that you can trust, that you would be happy to have go in there with your elderly mother, father or disabled aunt and you know that they would treat them with respect and do a fantastic job. So would you be interested in, if any of us do know companies like that, to pass the details on? Because they're not likely to go through the portal, that's as much as I know about it, the portal to see if they can apply to be on the preferential tendering list or whatever it is that we run. They're just not up into all of that sort of stuff. But they're the salt of the earth, and you and we and our residents would get a fantastic job. I just sort of throw that in.
Yeah, certainly. So some work's been done with contractors over the years. So we used to run a framework of our own internally. What we found is we'd lost quite a lot of contractors off that framework, mainly because of the sort of pandemic, and it was a lot of people retiring and making different life choices at that stage. Or we had a couple of, I think, one business that went out of business. We've currently moved over to a framework that's managed by an external body, which we can pull contractors off of. So it works in a similar way. So we can get people onto those frameworks at any stage. So if there is, and we can support, small businesses to get on the framework, because sometimes the paperwork is quite labour intensive, and things like needing a DBS check because they are going to vulnerable people's properties, and being a good, they need proper accounts and all of those types of things, that sometimes the way we ask for things as a council can be quite off-putting to some of those small tradespeople, and it's those small tradespeople that we absolutely need to do these works, and there's quite a volume of them. We've got just under £3 million worth of budget grant per year, which is an awful lot of money to spread across a number of contractors. So it is quite lucrative business as well. So we need to make sure that they are proper organisations and are safe to use. But we know that there are a lot of small firms that need that support to kind of go through some of their processes to put them on those frameworks. So certainly with the new system, my understanding is, and I can double check this with the team, that we can add people at any time rather than a fixed period where we ask people to come forward, long as they meet those checks. And then we put jobs onto the portal, and then the companies that want to bid on those individual jobs. So if we just need plumbing work done, there might be some specialists that do that. Same with the clearance. There's a couple of companies that specialise in doing the house clearance work and things like that.
If I might come back, Chair, the point of raising this was that we get the money from government, and over many, many moons, you didn't spend it last year, so I'm not going to give you as much next year. You've got to always be aware of that. And I do appreciate that the 600 grand difference-ish between committed and actually paid could well be that we approved a lot of people at the end of February and they couldn't quite get the works done in that 1 month. I appreciate it could be that, but I think the more that we can get it right narrowed down so that we get as much paid out by the end of the year as we possibly can. So that was the reason for raising that particular issue. My people are actually DBS checked and all the rest of it, and they leave your house cleaner than when they arrived.
Agreed. Same, yeah.
Thank you, Councillor Harrison, for that insight. That's very interesting. Councillor Winkles, please.
Thank you, Chair. Yes, this is a very good report and I will be supporting it. But there's one thing I wish to bring up this evening. I had a meeting with Southern Housing today with one of my residents in Milton Regis. These places were built just after the Second World War in the 1940s and 1950s, the masonettes. Whereby this resident's very concerned that where you got the small kitchen at the top of the stairs, there's no sort of fire protection door. I asked the question, or was asking the question on behalf of this resident, I thought Southern Housing by law would be duty bound to replace this door, and the answer I got was, well, a new build they are supplied, but with existing properties they are not. supplied. I've only brought this up. I know this would have to go through government legislation to make this law, but I find it quite incredible, the turn of the century, that these housing associations. There's a loophole in this law. We did manage to get that the tenant, Southern Housing, will loan the tenant the money and they will pay it back on what they can afford. But to me, it just seems utterly wrong in this century. But I just thought I'd make that point. Thank you.
Thank you, Councillor Winkless. Councillor Martin.
Thank you, Chair, for letting me come back. It's just to check whether I need to put that forward as a formal proposal to change the first £10,000 as being disregarded to the £11,343.80 that is the pension. And if so, I would like to put that forward as a formal proposal.
Okay, so I've got a proposal and seconder. Can I have a vote on that, please? All those in favour of the proposal? Any against? The proposal is carried. Thank you. Can I have that figure again, please, Ben? Put you on the
£11,343.80.
Councillor Worcester.
I'm not convinced that necessarily will be around long enough to worry about that.
Thank you. So the question I've got, obviously, as I said before, I was on the working group myself. It did take us a while to get together, but I'm glad we did, because clearly from what you guys have said tonight, moving forward, we've got to get this sorted and we've got to get it done. And I thank you for the figure. So it's going out to consultation. How long before it comes? What's its pathway after that?
So the plan is to get it out for an 8-week consultation, so it won't be completed by the next committee. So it would be the first committee of the new civic year, which I think we're waiting for the dates to be finalised of that.
Okay, so members, are we happy to take the rest of this report tonight, including the amendments on page 11, which is replacing R with maybe, and page 23, Cabinet Committee of the Council for Appeals? What would that go to? P&R? Or would it come to here? Come to here. Councillor Gould, I saw your hand shoot up there.
There's just a couple of references to cabinet members on page 20, I think it is as well, which might just want to be changed.
Okay, so members, are we happy with putting forward the rest of this to go out to public consultation? All those in favour? Anybody against? No? Okay, thank you very much. That goes off for public consultation. Thank you. Item 7, temporary accommodation spend scrutiny report. Charlotte.
Thank you, Chair. So this is the regular update in terms of where we currently are with our temporary accommodation spend, and more importantly, updates on the mitigations that we've put in place to manage that spend. So first of all, I thought I'd like to update the committee around that we had confirmation of our housing prevention grant for next year, along with our rough sleeping funding confirmed. So the housing prevention grant has increased from 952,700 this year, and next year we will receive £1,346,129. So despite that grant being very welcomed, however, there has already been substantial growth put within the budget from the base budget already. So that is only really offsetting investment that the council has already put in place, and is a contribution and not a full cost recovery from the MHCLG grant. So I've included here just updates on the statutory TA placements. So at the end of Q3, we could see that the numbers within temporary accommodation had fallen down to 274 households, which was sort of the lowest again over the sort of quarter periods. I was going to give you a live figure, but my thing, unfortunately, hasn't stayed that low. But we always know January is high for a range of reasons, one being caravan parks and various other things. We are, as of today, at 285 households. But the figure that we tend to report on is the end of the period, the end of the quarter figure. One thing that we have been really targeting as part of this work is to reduce our use of bed and breakfast and nightly lets, mainly because these are the most costly forms of temporary accommodation. And again, as you can see from the table, at the end of Q3, we had 160 households in nightly let accommodation, which again is significantly reduced down from the previous quarter. And when we look at the end of year figure from 23-24, you know, we're down by 44 households in nightly let accommodation, and that it all does add up quite significantly. Another positive progress is the temporary accommodation purchase programme. So we are, at the end of Q3, had 40 properties within the portfolio. That's already gone up. I know we've exchanged on a property today to complete on Friday. So we are nearing the end of the decision to purchase 50 properties. We will probably be at that stage, if not by the end of the financial year, very, very soon within the new financial year. Just waiting for, obviously, the legals to go through. However, what we can see is the housing register demands going up. The housing register is increasing all the time, but the lets are fairly stable, and the pipeline of new affordable homes is fairly low. So that's kind of where we are in terms of that performance data. We have also had, as I've already sort of mentioned, particular impacts this quarter from the caravan park closures. Even though I think we're currently accommodating about 12 households that have come from a caravan park, we've had significantly more inquiries, and we know that that's probably an underrepresented volume of the people that we know that use caravan parks as their permanent home, which, also linking into the previous item earlier today, is not a suitable accommodation to live in all year round, and doesn't meet standards of a decent home at all. The other thing we've had operating intermittently throughout December and this month so far is the SWEP protocol, which is the severe weather emergency protocol, which, if temperatures reach 0, we offer emergency accommodation to anybody that contacts us. In previous years, we have received winter pressures funding from MHCLG. This winter, we haven't received that funding, and when we've made inquiries with them, it was because of our outcomes with our rough sleeping service being so good that we didn't qualify for the funding, which was quite disappointing, really. Because we obviously still have a need, and we are still bearing costs as a council for providing that service, which is obviously quite needed. I think it was also important to note that we are still getting the our own temporary accommodation programme up and running. So I mentioned that we have 40 properties, 27 of those are currently in use. What we are finding is some of those properties need work, and that is taking a bit of time to get that turnover done. But as soon as they are able to be occupied, they are occupied, and we will move people from nightly let and people that are already within temporary accommodation into those properties. We do have one that has still been impacted by the fire damage, which I think I reported at the last quarterly meeting, but the insurance works are being undertaken on that at the moment, so we are hoping that property will be back in use very soon. The other things just to mention is that we have an agreement with Southern Housing to utilise Old Johnson House and Bridge House. Old Johnson House is fully on board and that is fully occupied. There has been a delay with Bridge House. We are meeting with Southern Housing tomorrow to find out how we unblock that issue. It's an issue that they have with the previous tenants that needs to be resolved. So once that is resolved, we will start utilising that accommodation. But as that currently stands, we haven't got access with it, even though we've got the agreements are already set up. And as soon as we can use it, we will start using it. And I think the only other thing to really mention is that the committee made the decision to invest in more staffing. We are in the process of implementing that restructure, and I'm hoping they're out. I'm not sure I've seen them, but we've done some internal recruitment, and we are just going out to for some external recruitment to the final vacant positions. So I'm hoping that the new structure will be fully staffed by the beginning of April. But we are already seeing some benefits where we have made those changes to the teams and changed some of the management structures, so there's a bit more resource to focus on some of the areas of development that we need to do that we just didn't have the capacity to do before. So a lot of the work that this committee has asked us to do is definitely in progress and on track, and we are seeing that the finances are stabilising in terms of those going forward. I think the only other thing to mention is obviously the risk and issues again remain the same. Demand for homelessness services across the country is still high and anticipated to continue. A lot of people are predicting about a 10% increase year on year on homelessness demand. That can be a bit higher in the southeast going forward. We still have had very limited mortgage repossession cases come forward. And again, there are reports, I think HSBC released a report yesterday saying that about 2/3 of homeowners are having difficulty with everyday costs. So just putting the pressure on there and when things come forward. So we're still waiting for use of Bridge House. And again, that is a really valuable resource that we will utilise as soon as that comes on board. I think our biggest concern is around the delivery of affordable housing and the limited amount of delivery that is happening, because ultimately that is our only opportunity to alleviate the affordability issues that a lot of our residents in the borough are facing and why they end up approaching us as homeless. And again, just to say the risks currently is the high demand relating to the caravan park closures, and the impact of the cold weather currently is increasing not only approaches to the council and therefore impact on officer demand, but also the availability of temporary accommodation, and obviously lots of other local authorities competing for that temporary accommodation and the price impact of that.
Okay. Thank you, Charlotte. First up, Councillor Nundy, please.
Absolutely fantastic report. It's still a bit grim that there are so many people that require temporary accommodation, but that does appear to be a trend that is happening all across the country. But I'm pleased that your team have put in a real effort and have managed to reduce our numbers as much as possible. And that's only with sort of half the properties that we own being available. I was a bit nervous about moving that 500 grand a few months ago, but we've already saved 200, and that 500 grand would have been spent anyway. It's just been moved somewhere else, and it's obviously working. So hopefully over the next sort of year or so, we might really see some benefits for that. So that's fantastic. Thank you.
Thank you, Councillor Nundy. Councillor Gould, please.
It's just sort of picking up that point is really about the sort of cost benefit of the Swale-owned temporary accommodation. I was wondering whether as part of that you actually are able to sort of get figures of what the savings are coming from that as opposed to the costs, which hopefully would mean that be a programme that might be able to be expanded in the future. If it is saving that much money, it must be if we can demonstrate that saving, then hopefully that'll be a way of making the case for further expansion, because it does seem to be the most logical thing to do.
So we have scheduled in to do a review a bit later in the year. once we've got all the properties, because what we're finding is that the initial costs are a bit skewed at the moment, because obviously we need to put furniture in, and we're finding different issues with different properties. So once we know sort of a typical day and a typical sort of monthly running costs and what the void levels are, that we can understand if what we predicted is the reality. One of the biggest factors, though, of our own properties is the level of local housing allowance that we can claim as per the policy that was changed at the last meeting. That makes a significant difference just on that alone, let alone long as we can keep the cost of running our property. And if we don't need them at any point, then we can obviously dispose of them. So we will bring back a proper review once we've got all the properties and we can understand the true running costs of those as a business case going forward.
If I may come back for a second, but is your feel at the moment that it is cost effective?
Thanks. Thank you, Councillor Gould. Councillor Martin, please.
Thank you, Chair. I think it's moving in the right direction, which is always a positive. Always a positive on this side. I will ask, purely as I haven't found it in the report, are we on budget for the purchase of the 50 properties, or are we looking to be possibly slightly over? And in terms of the housing associations, obviously the planning committee I think has done a fairly good job of securing the 106 properties, but they're just not being taken up. Are there any recommendations that you would suggest to this committee looks at to try and encourage those housing associations or new housing associations to come into the area and spend their money in Swale rather than in Maidstone or Tunbridge Wells or London?
Yeah, so if I could pick up on the temporary accommodation purchase budget. So currently we aren't committed to the full 50 at the moment. I am waiting on some final costs from legal at the moment to whether we instruct on a couple more properties, because obviously the committee decision we had was the 11 million and 50 properties. So I obviously can't breach the financial limit that the committee gave or go from there. So we are just balancing the books in terms of that, and I'm just waiting for a few costs to work out what those limits of the property purchases we are. However, we did receive some local authority housing fund grant which contributed towards that, so that has increased the pot, so to speak. So we had 11 million of the council money, and we had the local authority housing fund money as well. So I'm confident that we will come within budget, and I'm hoping that within that budget we will get to the 50 properties as well. I think it's going to be fairly close, but clearly I would not go over my authority. In terms of the Section 106 properties, I think this is still extremely challenging. When we have spoken to lots of registered providers, we know that they're struggling themselves because they're trying to do a lot of work to bring their own existing stock up to standards and the requirements that are being placed on them, and capitalisation elements and various other things. So we continue to work. We do have some affordable housing providers and registered providers wanting to work in Swale, but they tend to want to do their own land-led schemes so they can balance them out and get the viability. What they don't want is taking up the handful of properties that have been negotiated as part of Section 106s and what their management footprints are like. So their model of delivery has changed, but we still have the Section 106 elements that just aren't quite getting there. So we know that we've got a pipeline of properties that have been secured, but we have a huge number that just unfortunately don't look like they're going to be delivered when we currently look at that. And so anything that the committee can do to any ideas that there are there. We regularly talk to all the registered providers, and Rebecca Walker has a fantastic relationship with a lot of the development teams, and any scheme she will put out, and when developers themselves come back and say we've spoken to everyone, she will go and double check to make sure that they have spoken to everybody as well. But we just know that the numbers aren't stacking up at the moment for them financially to be able to take those forward. So we'd be more than happy with any options to provide more affordable housing would be gratefully received. And yeah, any encouragement we can do to get people building here or taking the already secure properties would yeah, definitely would like that.
Okay, thank you, Charlotte. I have Councillor Worcester, please. Or did you have a... Sorry, Don.
Just to try and save you a little bit of money, I'm assuming that we've applied for some of the social housing decarbonisation fund for some of those remedial works that are required to get the properties up to standards once we've purchased them.
Our properties are in our general fund, so they're not eligible for...
Damn it. There's some grant out there, trust me.
Thank you, Councillor Martin. So, Councillor Worcester, please.
4 quick points, thanks, Chair. Always succinct. We've had properties that belong to social housing providers in Sheerness that have been empty for 5 years. What can we do to put pressure on these supposed partners of ours to actually fulfil their commitments to the community and bring that housing stock back up into use? And also, what are we actually doing to make sure that when they place our tenants that are on our housing list in those properties, they're not leaving them with no gas, no electricity and no food? Because yet again this week, I've had people contact me from very well-meaning local food banks and charities that are pulling that again from the charity sector, when actually these tenants have been in that property for 3 days with no food, no electricity. It's not surprising that some of these tenants are just walking out and choosing that actually, you know, they're not getting the right support, so they're leaving those properties even though we've tried really hard to get them into properties in the first place. I would like to be reassured that there is a very, very good vehicle for those charities that are reaching out to help with homeless support with SWAL, that they've got a way to be recognised by SWAL as partners in providing whatever support they are doing. That's my next question. And the last one is, over Christmas, I had 11 residents, people contact me on Sheppey wanting to declare as homeless. It's pretty much as soon as the council shut down. And the main issue that we found, or I found, was that when they were declaring, it was a very difficult situation. Some of them would be looked at within a couple of days, some of them would be looked at depending on resources that were absolutely available, and the out-of-hours service as it is. That it was very difficult for those people to actually get up and running over the shutdown period. And my concern is that when we're looking at these houses and things coming forward, are they in the right area? I know what developers are like, that they don't particularly want to provide social housing and things like that. But it's about those houses coming forward in the relevant areas, because some of these people are being offered houses that are out of their area with no public transport support and no way to get even to a relevant supermarket. And I think it's one thing to look at it on paper, but actually in practice, are we still hitting those crucial elements? And I think it's important to look at it in terms of numbers, because you could have a very positive numbers picture going on, but actually in reality the people on the ground are finding it very difficult to deal with Southern Housing and their changing management model or other partners, the same as our changing management model. So those are my points. Thank you.
Thank you, Charlotte.
Yeah, so I think there's a couple of points there. I think it's really difficult, and we know that public sector resources and charitable sector resources are squeezed to non-existent. Years ago, you would have had a raft of tenancy support officers and tenancy sustainment officers going in and helping people settle into their properties. Those roles just don't exist anymore, and I think that's like you're seeing the charities picking up some of the burden there. I think where we know we particularly got vulnerable clients, and we try to, when we're taking people out of TA, and into their permanent accommodation, there will be some people, they're absolutely fine. You can send them an email, here's the details, go sort yourself out, and you know that they're more than capable of being able to do that. We know there's vulnerable clients that need that additional support, but again, it is very limited around, and it does depend on knowing what support that they do need. So I think it's a hugely challenging area. I don't think we all have the answer because we don't have the resources to put in the solution that probably is required at the moment. But again, we can ask our housing providers around their tenancy support and what they are doing with their vulnerable clients. And I think it is about flagging those issues when they do arise so we can understand that picture going forward and where things need to be invested in more. I think there are a number of charities that we do work with and voluntary and community sector groups that are there absolutely to support a wide range of organisations and people and individuals, and we do signpost to people regularly and work with them. Sometimes there are some organisations that are quite challenging to work with as well because they want to fight the council as well and not just want to support them, and understand that we've got different responsibilities going forward. I'll take away what you said about and it'd be interesting to see what those residents were contacting us about and whether we can track them through the out of hours service. We obviously do have the out of hours service and people are placed through that, but they do need to go through a bit of an initial inquiry at that stage, and their eligibility. I'd say from an officer perspective, a lot of the clients possibly could have approached us before it got to crisis point, but we do understand that sometimes people don't want to deal with the issues and they've got a lot else going on in their lives, and it gets to the point where actually this is reality, I need help now, and we'll go from there. And then obviously the service that we can provide to them is a little bit more chaotic, and it is a bit more an emergency response rather than saying, we know that you're going to lose your accommodation in a couple of weeks. What can we do to support you? How can we help you? So again, I think it's about encouraging people to speak to us as early as possible, and particularly within the 56 days, which legally we've got those prevention responsibilities as well. There was a decision to close the council for a period of time. So we do have an out of hours provision. That out of hours provision is the same that's provided by all councils. We all use the same company, so they're very experienced in terms of dealing with those type of inquiries and have access to booking our temporary accommodation and things like that. But it is, again, it's quite challenging because we don't pick up the detailed casework until the offices are open again. And go from there. In terms of developers building in the right areas, again, that's all planning policy led. So again, it's a lot of it's down to viability and what areas can afford to provide those affordable housing units, and sustainability and transport links and all of those things are a consideration for the development as a whole rather than for affordable housing clients going forward. So I think it is about just balancing those things up. It's not right now. We need to improve these things, and I think understanding that and getting that picture to inform future policies is really important to go forward with.
Brilliant. I will just say though that during over the Christmas period, it was shocking that I was discussing SWEPT with a number of different agencies, and they had no idea what SWEPT meant, and that included some call handlers on Kent Police. And I think that education element there needs to be much better. And oddly enough, I even contacted the out of hours for our own, and they hadn't got a clue whether SWEPT had been declared or not on some instances. There's obviously protocols when that is declared and when it's not declared, absolutely. But I think we could do much better because one of those people that were heavily declared via actually agency report over on the island was actually a family. And the problem is that safeguarding was an issue. And I don't feel that, for instance, that was given the urgency that it was needed in that situation. And I think that is a problem with regards with how agencies work together to solve the problems that they can. We all know that they're lacking in resourcing. Of course, everybody knows that. But that sharing of information, that training of new people, that has to be held accountable at some level. And also to make sure that what resources are available can get to the people that need it the most at the right time. So thanks, Charlotte. That was brilliant answers. Thank you.
Just to come back on the SWEP, so once SWEP is activated, our out-of-hours service is notified, and therefore anybody that approaches our out-of-hours, it will be. It's not our out-of-hours service don't have to make that decision. We make that decision and we notify them that that has taken place, so they will know whether SWEP is activated or not. As part of that, SWEP is dealt with by we utilise the public guidance, and we adhere to that. Some councils have varying policies. Our policy, I think, was last updated in 2019, but it mirrors the best practice guidance that's out there. So that's kind of where we currently sit with SWEP.
Just because I singled out Kent Police, BTP officers didn't understand what SWEP was either. So it seems to be a bit of a problem with information sharing there.
Okay, thank you. Councillor Bowen?
Thank you, Chair. A couple of comments and suggestions and questions. When you said about the grant money, I just find it really frustrating when people or groups, councils, whatever, get penalised for being good. And it's hardly surprising that you end up in this yo-yo point where actually you're not very good, we'll throw money at you, you become good, we take money away, you go back down again, and it's that all the time, and it's really frustrating of any authority, government, whatever, to withdraw that. I get that, okay, if you are doing a good job, you may not need as much money, potentially, but to suddenly say, no, you're not getting any of it on your bike, it just baffles me at times. On the subject of the mortgage responses, again, I think it's a false economy, and I'm glad, I don't think we now have the days where banks are offering like the 100% mortgage, if memory serves, and people are mortgaging themselves up to the high hilt, and any change in the interest rates puts them into pressure. And the knock-on effect of that is that if they can't repay the mortgage, they get repossessed, they end up leaving and potentially going into rental accommodation, which the rent is even more than potentially what their mortgage was paying in the first place. There's got to be, I think, a better way, or I wish there was a better way. I know we looked at it, I think we looked at it a few years ago, and it's going to be tongue-in-cheek, but not tongue-in-cheek, in terms of sort of housing accommodation. Another council have used it, but was shipping containers. They can be converted into, and I've seen them into pretty good accommodation, certainly better than some of the places which you see out there. But my actual couple of questions on the report on 2.7, it said about works are currently taking place to enable the use of TA. When do we know when that's going to be completed? And on 2.11, it says in terms of financial monitoring, the temporary accommodation costs to November, December figures will be provided at the meeting. Have you got those? Please.
Yeah, certainly. So in terms of shipping containers, we have looked at that fairly recently. So there is Ashford Borough Council have just launched some, and I think Maidstone had some in. Had planning consent for some. So we had that company come and look at our car parks that we'd allocated for affordable housing, and unfortunately they weren't suitable. They did some surveys and they weren't suitable for that. So the idea is that you have like meanwhile land that it's fairly level and has water and electric, and they work quite well to put them on there for a period of time. So our available land at that stage wasn't suitable for various reasons, mainly because it wasn't very flat or didn't have one of the utilities coming forward easily. I think it's certainly something we need to review our accommodation strategy going forward. We know that these numbers aren't going to go down, so having the control of the cost is probably the most important thing, and understanding what we're secured into. So a bit like sort of mentioned and responded to Councillor Gould's question around the value for money and the business case for our own purchases, I think we need to weigh up how effective that scheme was, but is there any other opportunities for other investment in any other types of provision, and look at how we take that forward. So I think there's all ideas are welcome in terms of how we can do that, and obviously products change over time as well, and viability changes in terms of what might not have worked before because costs weren't too high. Now, because the costs have gone up and everything else and the demand's gone up, it might now stack up. So we can certainly relook at those.
I'm just stacking up with shipping containers.
Definitely. Yes, modular homes they are, and they are really quite well designed these days, and come all fitted out with kitchens and beds and everything else, so you don't even have to worry about the actual equipment and stuff as well. And I will endeavour to find the updated December figures.
Is that okay, Councillor Byrne? Councillor Harrison, please.
Thanks, Chair. I wrote 2 points down. One, I sort of hesitate to mention caravans. I know we've not had many people approach us, but or fit the criteria that we've got a house, but there's a hell of a lot of applied. I think we need to bite the bullet on this, and I do not mean, oh, stay open 12 months a year. Let people live there permanently. They're not suitable. They really aren't. I think we need to bite the bullet on this and force the park owners to actually run their places as they should be, which is you need to provide a permanent address before I let you utilise this caravan. That's what most of the rules are, and I think when we get into the next year, I think that's something that we should actually be doing, because otherwise what we're doing is just storing up trouble for ourselves, because as we've known over the years, oh no, I go abroad for a couple of months. Oh no, I go abroad for a couple of months. Oh, I haven't got the money to go abroad. Oh, it's okay, I'll stay with my daughter, son, whoever. But eventually it comes to the stage where actually you can't afford to go and stay anywhere, so you rock up and say you're homeless. And if you're vulnerable, we've got no choice but to find you a home. But you knew 15, 20 years ago when you bought this permanent home, it wasn't. I don't think it's us. We need to be pushing our colleagues across the authority, because it is an issue, and it will become a bigger issue as we go forward. The other point that I had down was grant for housing prevention, but also the RSI. When we are given these grants, I mean, the rest of you might not be interested, but when we are given these grants, it isn't usually, oh yeah, put this towards your work. There is usually a hell of a lot of criteria about, no, you've got to tick this box. No, these are the people we expect you to help. No, this is where we expect you to spend it. And I think in terms of this committee, which is quite tuned in, I think everyone needs to be aware that it isn't a bit of bunts coming down from the government to help out the budget. There is a lot of criteria that we have got to match. Otherwise, at the end of the year, we may well have spent that money and a lot more besides. But if it hadn't been spent on the right things that they want us to spend on, and it's not, to be fair, it's not just this government, it was the last government and probably the government before. It's always been the same, whatever they're called up there, DCLG, MCLG, and all the rest of it. And I think it might be useful for members of the committee, perhaps next time we have a TA scrutiny report, to have that down, because, say, I know that it isn't just, here's to help out your budget. There is a lot of criteria that we have to adhere to in order that we keep that money and don't actually have to pay any back at the end of the year. And the same with the RSI funding. You know, there are certain things that we are expected to do. The homeless, I totally agree, Lloyd. You know, we had it years ago with the police. Oh, you've got your crime figures down really well, yeah. So we're going to remove a couple of officers. Short-sighted, very short-sighted. I think it was just those two grant funding things that I thought it might be useful for the future, and maybe also the SWEP. I know when members have got onto officers about SWEP, and well, you know, this man Ben Martin, he's homeless. You need to find it, and it's really cold out. Find him somewhere to stay tonight. Well, actually, you know, it's only 2 degrees. It's got to be 0 before we give you somewhere to stay tonight. There are rules, there are policies, there are protocols, and they are there for a reason. And as I said to my colleagues very recently, in housing, there's very little discretion, because otherwise you could be accused of favouritism. You have to apply those rules strictly by the book and treat everybody exactly the same. And I think that in terms of SWEP as well, it might be useful just to have a paragraph, because the next, it won't be the quarter, will it? But anyway, but the next meeting, it might be useful to say this is what's happened on this, and these are the criteria that we are expected to utilise. The day we start using our discretion on this sort of thing, I've been here a number of years, as you all know. Well, it's one of Councillor Harrison's residents, and she's always been very helpful to us, so we're going to find them somewhere to stay. Oh, Councillor Braun's new. We don't really know him, so we can't help your person. Is that what we want to get into? No, we don't. All the time they're applying the rules strictly by the book, then nobody can claim any favouritism or anything else. But as I say, I do think in terms of members, especially as we've had quite a turnover of members, it might be useful on that next report to have these bits in. Thanks.
Yes, certainly. So I've noted down to sort of do a update on the grant conditions, and I can also give you an update with, hopefully by March we might be out of the cold SWEP policy. We do have for high heat policy as well, but it's more about providing shelter and sun cream and water, because rough sleepers out in the high heat is also a public health issue. But we can give you an update on that and how much contact we've had there as well. Just to sort of note on the caravan parks, even though we haven't placed a huge amount of people, we have had a lot of inquiries, and we have been approached by a new owner of some parks that have had quite a challenging situation trying to follow the rules, and they want to do things properly, and they're trying to do things properly, and they're finding it very challenging. We are establishing a project to do a wider review of caravan parks and why people go there in the first place. We know it's because obviously it's cheap, but again, is there a way, because they know they shouldn't be there, they're also not approaching the right services to ask for help, and that's when we end up in that crisis point when the parks close, rather than be able to help them maybe when they can stay there for a few weeks in the summer. And you know, it is a pleasant place to be at that stage, and what other interventions can go in place. So we will be doing some work to try and alleviate this issue, but also try and tackle it, and I think that has to be in a multi-agency perspective. Just understanding some of the clients that have approached us, and we have accommodated. They are quite high needs individuals, so you know, they shouldn't be living in a caravan really, for that reasons. And if I can also go back to Councillor Bowen's question, because I've got the figures now. so to the end of December, we had spent 3.1 million on our sort of external provision. and the equivalent period the previous year was at 3.4 million.
We're getting there.
Excellent. Thank you, Charlotte. This is a great report, and I appreciate it coming to committee. And I think our thanks should go to the team, because without them, our figures wouldn't be looking
Most definitely.
as good. Could be better, but they're looking. We're definitely turning around, and it is so frustrating that we've been so good, so they've taken the money off us. Very frustrating. So I feel that frustration. So thank you for that, members. This report was to note. So if that's okay, we shall note that report, and we get to item 8, which is the forward decisions plan, which is also to note. Have we got any updates, Charlotte, on who we've got coming where?
Thank you, Chair. So in terms of the forward plan, at the next meeting, we have Southern Housing coming along. Principally, it was to talk about the overview of where they are. I think many people know that they've gone through quite a substantial merger and therefore restructure that's gone forward. But also, I know that there are some key questions around the stock condition. If there is anything in particular that the committee would like them to answer, if you could let us know in advance, and we can maybe collate some areas so they can present to you the information rather than them coming and saying they have to get back to you. If we could sort of have those ahead of the meeting, maybe a couple of weeks ahead of the meeting, then we can make sure that the appropriate people are here and the appropriate issues are addressed.
Okay. Councillor Bowen, sorry.
Thank you. Just an observation and thinking potentially prepping for what may be lying ahead. Would it be prudent to have a report, possibly March, not long after that, on what the eventual decision will be from the Secretary of State in regard to devolution and the impact that could have in terms of any mayor system on health provision? Because obviously there are plans, if it's agreed in terms of the Police and Crime Commissioner, but what impacts that could have on this housing and health within the current establishment and what the future may actually be. I would suggest or whatever may be known at that point.
I think for March might be quite challenging because I'm not sure we know. But I could certainly put it on the forward plan to do an implications update at some point in terms of that. Because again, I think there's lots of questions and we need to find out what the more details are.
Councillor Martin.
Sorry, in addition to the health aspect, can we look at the housing implications as well? I'm thinking it may be that we don't have sufficient time to get a spade in the ground at Rainbow Homes, so it might be that we just have to pull the plug.
Members, are there any other questions regarding the forward plan? Charlotte?
Definitely not a member. But, I was going to say, would you like me to put on the review of the temporary accommodation purchase programme to bring back in the summer?
I think that would be a good idea.
Part of that?
Yeah, that would be perfect. Anything else, members? Okay, well, thank you, members. I hereby close the meeting at 9:04. Thank you.